lead pioneers in IT, talk to us for 1 good hour on the topic of managing organizational risk during the world pandemic. Before we begin, I'd like to quickly introduce everyone on our panel today. For today, we'll have our moderator being Mr. Mike Melore. He's an IBM security advisor, certified CISSP and author, frequent national speaker and moderator, and recognized subject matter expert in security and threat intelligence, identity access governance, authorization, pioneer in identity access management, access governance, and authentication, and past consulting roles, including lead architect for many of the world's largest authentication authorization infrastructure. This includes two of the first individual billion user authenticated infrastructures. He's a founder, moderator, and group secretary for 13 regional CISO security legal roundtables across the U.S. And across the U.S. Next, we have Mr. Hussein Syed. He's the Vice President Chief Information Security Officer at RWJ Barnabas Health. At RWJ Barnabas Health, Mr. Hussein is responsible for information security and the organization of the HIPAA compliance security governance program, and his team is responsible for information security functions for the healthcare system. Prior to joining RWJ Health, he started his professional career as a consultant in the networking system management practice with the solution integration. He later joined the startup lead in development and management of infrastructure. Next, we have Mr. Charles Gagnon. Mr. Gagnon is a senior director of IT infrastructure and has been responsible for the technology environment at the New York Genome Center since 2017. NYGC is an independent research institute focused on genomics and whole genome sequencing. Sorry, speech impediment today. The center is a hub of collaboration for key domains like cancer, neuropsychology, decrease, and neurodegenerative decreases. Charles is an experienced technology and business leader with experience in both biomedical research and finance experience. He is focused on building and leading teams to maintain high-performance heterogeneous infrastructure and specialize in finding the best technology solution to solve complicated problems while respecting an intricate set of constraints. He has over 20 years experience supporting traditional and quantitative efforts and on-premise cloud-based platforms while focusing on computer platform networks and data centers, cybersecurity, and disaster recovery issues. And last but not least, is Mr. Timothy Swope. Mr. Swope is currently the CISO of Catholic Health Services, an 18,000 employee hospital group in Long Island, New York. Sorry, that's my only New York accent I can get. He's an information security IT risk management professional who partners with chief information security officers and IT governance, risk and compliance executives to assess and deliver IT security and risk management programs to healthcare and insurance, pharmaceutical, and governmental agencies. After spending over 2 decades assisting clients implementing secure enterprises, BI, EHR, meaningful use, and other data science systems, Tim knows and understands the requirements and components that create a secure information security posture. A key area of his expertise centers around interpreting and applying federal, state, industry regulations such as DSRIP, HITRUST, HIPAA, NIST, SP 853, 800-53, 21 CFR Part 11, health insurance reform, security supply and security standards, FISMA, and locally Zadoga Act. That's what I was going to butcher there, to name a few. He also supported cybersecurity requirements for a Medicaid delivery systems reform incentive payment program at 2 of New York's largest PPPs, Northwestern Health and NYC Health and Hospitals. Again, thank you all, and I'd like to hand it over to Mr. Mike Melore.
Well, thanks for having us today. I think we're going to have a nice, lively conversation. The first question that I'd like to pose to the panelists, or I'll start with Tim Swope. So Tim, how has the COVID era, the remote workforce that we're all facing right now, how has that impacted or changed the risk scene?
One of the things it's done is it's expanded the risk beyond the walls that we're normally used to. In other words, now the risk has spread from our offices, our corporate offices, out to the remote users in their homes. And also, one of the things is it's also expanded into the areas of our own vendors. So We've had to increase monitoring capabilities. Um, Things like patching, things that were very simple to do in our own organization. Now we have to our schedule, make sure people's computers on, and really also the ability to work and monitor people from a personal standpoint, and to make sure that they're there to get the things done on a 24/7 cybersecurity model that we all have.
Mm-hmm. Any other perspectives from Charles, Hussein?
Yeah, Michael, it definitely changed how fast projects have to turn things around, right? So we saw it specifically at the beginning of COVID, where basically some organizations had a very short amount of time to get all their workforce remote and to get all that squared away. And in that time, you needed to be secure. You needed to keep focusing on your risk management and do all the governance process that you have, but you also needed to act quickly. And I feel like historically, there was always this sort of trend that projects could either be very fast and agile, or they could be secure and robust. Mm-hmm. And I think this was the time where everything had to come together. Things had to stay secure because there was a ton of issues that were circulated around COVID time. But things also had to happen very fast, because once employees were not coming into the office, you didn't have the luxury of months to get that set up. You had to be ready in a few days.
Mm-hmm.
Yeah, I mean, to build on what Charles and Tim have said, it was a moment for our organizations to step up, especially in the healthcare arena, in order to take care of patients first, right? So it did whatever it had to be done to enable the workforce to be remote, to be collaborative in whatever shape or form they needed to do. In all healthcare operations, it's you can't just provide patient care if you don't have proper supply chain processes enabled, and the rest of the frontline workers that support the medical staff to be able to provide the services they need to. But it introduces another challenge. All the business continuity, all the risk management processes were built around how the operations take place at that given time. And with the fast-paced change in how we moved around to accommodate the pandemic-related infrastructure needs, I think it's now time to go back and reassess all the processes and do another sort of a wave of risk assessment and identify where procedural changes are needed to accommodate that, because now that's our new norm. So to build on that new norm, we need to actually take a step back, reassess, and educate the workforce in how the things are done now. Because as Tim said, that we don't have the four walls or the firewall infrastructures anymore. We're all over the place. So identity has become the new firewall, so to speak, where you drive everything off the identity of the user as opposed to the workstation.
Mm-hmm. One final thing on a good point, we've had to drive innovation in the healthcare world. As Hussein probably, we expanded to giving services, to having to change a different type of patient experience in a more secure manner. So, I hate to say, don't let any crisis go unwasted, but we've actually allowed ourselves to innovate in a way that can actually is delivering good services to, let's say, some folks that could normally not get into the hospital. Now we reach out to them, and it's something that needed to happen. So we were quick at innovating in that area.
Yeah, we persevere, right? The healthcare is a industry that has to persevere in any event, because we are, a critical infrastructure service.
Mm-hmm. Yeah, that's a great point, Tim. And all the three of us are within the healthcare world. But I think we've seen the same across different industries, right? Whether it's education or finance, everybody's had to adapt and find ways to provide the services in a way that's secure, where you can trust the identity of people we're dealing with, but also that you can effectively do it remotely without wasting too much time.
So I'm aware that a number of organizations have challenges in aggregating all of their incidents and their risk, and then normalizing that, and then reporting that on such a frequent basis to their chief executives. So if you wouldn't mind, and maybe we'll start with Charles on this one. So Charles, how are you measuring the and reporting that risk to your chief executives, the boards, maybe the lines of businesses, and so forth? How are you doing that? Are you automating that?
We're trying to work towards that. So the New York Genome Center is a small organization. We're roughly 275, full-time employees. Our budgets are largely driven by philanthropic efforts, grant-funded research efforts. So our operation has to sort of remain lean and low-key. We don't have, a full compliance department and a CISO department and all these different groups. So we rely on few key staff to get a lot done. So the key for us, and that started a few years back, was to really get started smaller and just get started with the mindset of governance and risk management and compliance. And I know that everyone shuns sort of the uses of spreadsheets, and it's generally not a great tool for long-term strategy. But that's where we had to get started, right? To make sure that we track proper controls, and then we put that in there. We also had to implement sort of a basic project management, governance, so that we could move away from being very, very reactive, where people were just doing tasks that were assigned to them, being more proactive, where the engineers on the team were looking for, all right, I have this task to do. What project does this relate to? Where does this fit? What does it improve? Is it a priority right now for the entire center? So once you have sort of these pieces in place, then you can start to collect numbers and get more visibility and produce reports. Now, because a lot of that is manual, when you get started, the reporting cycle is not going to be, it's not going to be real time, because it's going to be a process to sort of collect the information and update the reports. But once you have this mindset in place, you start to collect the information, populate the right systems, then you can look into, a lot of the tooling that's available for governance and risk management compliance. There's a ton of them that help facilitate that process and to do the same thing with fewer resources. So then you can look at full frameworks like COBIT or ITIL or whatever framework you want to look at, to really try to formalize your risk management process and then increase your reporting. So we went from, reporting to the audit committee of the board of directors maybe every 2 years to now having, close to real-time visibility into how things go. And that's, it's definitely a process and it's a mindset change, but once you get there, you get good results.
Anybody else want to weigh in on that?
Yeah, one of the things that we do is, and again, before you even start with a risk management program or even look at risk management tools, we defined our risk tier levels, like, risk 1, a risk that requires mitigation and that might not be acceptable. Risk 2 levels, the next one down, risk is considered acceptable. And risk 3, very low risk, that might offer some cost savings. But then we have a risk determination and assessment process where we look at 3 factors: the likelihood that the risk would happen, what's the business impact to our organization, which is different depending on what your organization is, and then what are my control effectiveness? And doing that, we've actually created a mathematical equation that gives us a risk tier based on the likelihood, business impact, and control effectiveness. And when you have those, those are actually the pre-tools that you can put that information into a Risk Connect or some of the other tools that are out there, RSAM. We actually do a lot. I do a lot of the tracking on a spreadsheet with that, and then on a quarterly basis, I bring them to our board of directors so that they can understand the risk that we have. We're a hospital, so we do our triage on them and the highest priorities first, but then it gives them some sort of an idea of the cost to remediate some of these, and we also have metrics for the benefits. So when you bring all those together, it puts the risk in a more real way that they can touch and understand how they affect the organization and the impact that they might have if they're not remediated.
So are you able from that reporting to distinguish maybe from the last period to the current period where there's a heightened risk posture and so forth, and even trend some of that maybe?
Yep. In fact, you can do that. You can trend it over time. You can do a lot of trends too, not just the risk, but how many risks you remediate. We've got a small staff too, and we all, have, as Charles said, they might have a small staff. We have vendor risk analysis requirements for annual, and we want to see how we can actually do those. So you do have to trend, monitor the amounts that you do, but also, make sure you're focused on the high risk ones first.
Now, how about someone with unlimited budget? From like Robert Wood Johnson Barnabas.
Are they hiring? Are they hiring?
No, I thought you were alluding to the IBM.
Yes, that's what Mike's talking about himself.
Exactly. He's talking in that third person. Like I should have given a disclaimer earlier, but I'll do it now. Most opinions are mine and not of my employer or a former or future employer. So some of that context really is, my opinions. And so, like Tim and Charles said, risk assessment is a very fluid process. And the risk in cybersecurity keep changing. And in some areas, they keep getting magnified. And there's so much information out there. So we have to have a very defined risk assessment process. And the results of that risk assessments need to go into a risk register so that we can create some key risk indicators to inform the executive management of where we are focusing our efforts on. Like, unlike IBM, we don't have unlimited budget and open checkbook, so we prioritize higher risk items first to address them and then report on them as they get. And some of them take longer to address because they're not, short-term fixes. You can do some tourniquet type of stuff, but you have to come up with a very sustainable process to mitigate the risk, weighing in how that risk affects the operations of the organizations as well, right? You can't make a change without taking into account how it affects the user community. They have to be educated, they have to be trained on using different processes, because ultimately it's a business people process technology problem in cybersecurity, right? Not just a technology issue. So a lot of risks can be mitigated by process changes, right? So some of that needs to happen. Ultimately, the board needs to understand how committed an organization is in addressing the information security risks, and that's really what our intention usually is, to inform them where we are, where our destination is, and how we're going to come back to it and reassess and continue to grow.
Now, are there challenges in even aggregating that information and pulling it from all the different sources? Because now a number of services are likely even in the cloud and all scattered all over the place, right?
It is. There are so, and that's what I said. It's a fluid process, right? We keep adding different tools to assess different areas. Some is desk side, manual process of interview style risk assessment. Other is, to get the data from certain sources, which could tell you the health of that environment and how that you can now assess the risk where based on whatever data you have. And then chart it and historically see how the trend is changing. Are we going in the right direction, or are we stale? And sometimes, you want to just be plateaued because that's your risk tolerance. And in some cases, you want the risk to go down depending on, what the circumstances are. And so that it gets all taken into account, and cloud's here to stay. So we might as well learn how cloud works and what the risks are in the cloud and how to operate in the cloud.
So AI, and this one, I'll start off with you, Hussein, on this one as well. So AI and machine learning's been around now. It's progressing, evolving, I should say. And I know at IBM we prefer to even refer to AI as not artificial intelligence, but augmented intelligence. So how is like the augmented intelligence, machine learning, and other tooling, behavioral anomaly detections and all, how has that been effective or maybe not effective, and how are you maintaining staying up to date on your threat intelligence? How do you keep pace with the broadcast of information that's coming at you?
Wow, loaded question there, but I'll take the layman's attempt at trying to answer that. So the industry is growing. There is a what I would say a fatigue of intel coming our way around threat data. So we're utilizing a number of tools that are basically ML AI based. We don't develop them ourselves. We have partners that have developed them and have provided them access to those tools. And some of them are paid for services that we utilize, and they have helped quite a bit. I would say that's the direction we need to go in threat intelligence and some other areas in terms of navigating that deluge of data that's coming our way and the data we are ourselves collecting, the telemetry data from sources internally or externally, and be able to identify what we need to focus on. Mail security, data collection in a SIM, are a couple of examples that are being used around using AI ML based solutions to really augment the staff we have in determining where the threat is and how to react to it.
Mm-hmm. How about others on your view of the automation, where it is today and where it needs to go and so forth?
Automation and AI is really good, and I think it's a large piece of the puzzle right now. So it's a building block that's been integrated in. Some of the traditional tools are also just as valuable. People just have to recognize that there's a multiple of tools that they're going to have to combine together to make sure they get the appropriate solution. One of the interesting things with AI is once you have a big shift, right? So COVID, everybody went remote. We practically had to sort of re-baseline how our users were interacting with the systems because everything was getting flagged, right? Because all of a sudden everybody's remote. Some people went back to home countries and started working from there. So the footprint left by our user was completely different than what it was, prior to COVID. So then you had to sort of re-baseline and retrain the system based on that new normal. And that's something that people have to be ready for. It's not, you cannot unleash AI into your monitoring environment and just expect it to give good results. You need to be constantly looking at what's going on to see if you're getting what's expected, you're picking up the right things or missing important things. And then when new systems are added and things change in your environment or the structure of your infrastructure changes, then you need to sort of retrain your tools to make sure that you're in the right place.
Very good point, Charles, because it's such a dynamic area. It's not static, right? As the situation changes, and you want to separate, ML, AI-based solutions and automation into two separate buckets, because you really need to get to good amount of clean data that makes sense to you before you can really look to automate anything, to take any actions on that information you've received. If you don't understand what information is and what the impact of that is, and how to automate something to address an issue and do it manually a few times before you really go to do the RPA route, you're likely to have problems. And again, have enough checkpoints as the environment changes. How does your automation change along the way? Because if you don't change your automation based on the environment changes, you're liable to do wrong things and disrupt the service.
Yep. And I agree with both Charles and Hussein. One of the things is anomalous behavior changes depending on the anomalous thing that's going on. In other words, COVID. We got people working at 2 a.m. now. In the healthcare world, is if I could figure out a nice even flow for all 6, 7 of our hospitals, it'd be great. But there's anomalous behavior that happens all the time based on, incidents that pop up. So you actually have to interact. That's why I like, as Mike said, it augmented intelligence, because you literally have to interact with it. It can't run off by itself. I always tell people that Skylab has not been fully, deployed yet. So and self-aware. But so we do have to interact with it and understand what's going on. There's a lot of uses that we've used AI for too, outside of just the threat intelligence. We have electronic medical records. You now have tools that will see if people are doing those things they're supposed to do based on their policies that they've, and their work functions. It's almost like Orwellian Big Brother. And also, I don't know, there's companies out there, Mike might know of some that have great AI for healthcare with analyzing data scans, things like this. But there's some big movement also from an AI standpoint in actual healthcare and identifying things that would take 20 eyes to do. So I think we're moving in the right direction, but it is augmented intelligence, and it's something that people have to understand. You get it better by interacting with it and making those changes to it too.
So you bring up a couple of good points. I just want to hit home a little bit more. So that interaction. So right now, the AI and the machine learning and the behavioral anomaly detection, it's really for alerting and putting things into different buckets today, right? So are you seeing that a trend, and maybe we need to get better at maybe having automated triggers to automatically isolate and maybe automatically unlock users based on different circumstances? That, right now, that's, if I'm reading you correctly, so that's really, the interaction of the person interpreting whatever's being presented. Is that correct?
Yes, in fact, though, and here's one interesting thing in the healthcare world. For people like us, you actually have to know a little bit about healthcare. Let's say I was in finance, and I can block somebody and shut them down from anomalous trading.
Mm-hmm.
It's not going to kill anybody on the operating table. In healthcare, we have to understand that there's a fine line between security, having something automatically happening, and turning over and end over hospital operations because of some things that you do. So it's a different dynamic where you actually have to know, and hire people that work under you that are really knowledgeable on the hospital operations, so that you understand what real anomalous behavior is and how to
Mm-hmm.
attack it.
Mm-hmm.
So building on Tim's, right, in a geek way, you have to talk to the data. If you can't talk to the data and understand what data is telling you, you really cannot make a decision on that data, right? And that's really where the challenge comes in the whole, this decision support and data sciences field. Not only requires computer scientists, but also subject matter experts in the respective area you're looking to do any automation, right? You have to take the data, you have to train the data, you have to use supervised, unsupervised learning before you even go to the neural learning or deep analysis or deep ML phase, right? That's where cognitive decisions are made, and the data in itself starts to make some decisions. But to get to that point, it's a journey that could take a long time, depending on the skill set of the individuals and their background, their understanding, and their eagerness to learn. To get to that stage before you actually start making some automation decisions around any type of activity. A simple example would be, rogue devices on your network, right? Any device can be considered rogue on the network and quarantine and shut down, unless you have a very clean, crisp way of identifying good from bad. You may end up quarantining critical devices on a network that could have a lot far worse effects than, or shutting a printer down or taking a trader off the trading floor for a few minutes, right? So it's a journey, it's a learning process, and it's coming, and the healthcare IT is adopting it in many of different areas. Like Tim mentioned, there's some areas out of cybersecurity that are utilizing AI ML solutions, and they might do it much better than cybersecurity is doing it, because they have the plethora of knowledge in their space to understand and learn that data before they actually make decisions around it. There's going to be a lot more research using AI ML in any area that you pick up, not just in healthcare, but across the board.
And to add to what Tim was saying, on top of the healthcare component, where there's some things you can't shut down because you have big risks, I work in an environment where we do a lot of science research, and trying to do, anomalous behavior detection on a science researcher will throw red flags pretty much every single day of the week. A lot of these systems have been designed to work with, sort of the standard office environment that I'll call, a law office or a simple bank, right? But we have people who are interacting with, all kinds of other institutions in foreign countries. Some of those may be high-risk countries. That gets flagged. We'll have researchers who scan entire, petabytes worth of data on a given morning, and that's just because of the work that they're doing, and it gets flagged. And so all these systems have to be trained and adjusted based on, the work that you're doing and the output that your organization is trying to do. If I'm constantly slowing down research because of my risk management platform, or if I'm jeopardizing healthcare or lab testing because of my risk management platform, it's not a good outcome.
You're going to go back so far that coming back to where you were might be difficult, because impacting certain things is not a good thing.
Yep. And research requirements now with I know, Charles, you might see them grow, but we even, I'm sure who was saying, research requirements for outside research entities that are looking for COVID data. Now we've had to let them come in and pull out PHI, but we have to make sure it's in a secure way. We identify correct identification and authentication of these folks, because more than ever, I've had to allow, and some of these under government grants, data exfiltrating out of my system for people for a legitimate use that normally I would never do that. So, you know, we actually have inherent risks in things for research that we have to have compensating controls and monitoring now more than ever to, you know, to make sure they're going to the right people.
Exactly. Oh, you're absolutely right. I mean, that the whole research paradigm has shifted, and for the good, right? I mean, if there is no research, there's no progress, right? So that has to happen, and we just need to find the right way of accommodating the researchers to get to the data in the right manner.
Mm-hmm. So Tim, you brought up something, you know, so about. Let's take it around the third-party vendors, so and suppliers. So us in the risk business, we certainly always had our guard up for the risk associated with the third-party vendors and all. But certainly with SolarWinds and all, and you know, everyone else in the world now realizing, you know, the risk of the third parties. You know, maybe you could tell us a little bit about that third-party risk, and you know, and how you're viewing that risk and tightening things up.
Well, one of the things I've always been big on is third-party risk management, and that's just not risk assessment, but it's a long-term risk management of them. You know, we have requirements to not just for again, somebody with PHI, all highly critical data. Those are the ones that we actually have to review every year, but those are where we got a lot of breaches. In fact, in 2019, which I had for 2020, but by the end of 2019, 1/3 of all healthcare breaches came through a third party. These are people that, you know, well, we have a BA with them, still a breach. You know, they still had it loses that patient, you know, security that they have. So, you know, it's more than ever now also that when we do a risk assessment on a potential vendor, and if a couple of years ago we would have made sure, let's say SOC 2 report, high trust certified for that data area in scope. Well, now those workers are also working remote. So we've expanded our risk not just from outside into the vendor, but now we have to make sure that they have the right controls in place and attestations. And actually, sometimes I want the evidence to see it, that they have those types of controls in place for their people working remote, because you know, we've increased a layer outside our organization again from our remote workers to theirs. So that's been a big concern. And what you have to do is again work with those vendors. You know, make sure that they have deployed the right type of you know, I mean, sometimes if we can't give them that type of vendor a CHS device, they have to have a certain requirement, have to have certain capabilities. And then we've also created portals for them to come into, so they're not actually going directly, you know, VPNing directly in. So you have to think about some of those controls that you can have to work with your vendors. But over time, another thing I always make sure I accentuate to people is, a vendor today is not the same vendor tomorrow. In other words, there's certain things, scope of services change. They might be bought out by somebody. They might change their security from on-prem to cloud. So these things always have to be reassessed, you know, now in the COVID environment, but always that people forget that vendor's changing too. Hence your assessment of them should constantly change.
Mm-hmm. Yeah, I entirely agree with Tim, and it's a big investment. So a lot of people confuse the risk management and the risk assessment. And in some ways, risk assessment is the easier part, right? So have the conversation with the vendor and see where they stand, give them a questionnaire and collect the answers. There's different ways to do it. You can even go to shared risk assessments platform now, which offer you some information over certain vendors. But that's only one piece of the puzzle. For one, you need to implement a process by which you're going to constantly review the vendors. Then you need to also factor in, well, how important is this vendor for us, right? So what happens if the vendor's compromised, and what's the impact on my business process? Maybe it's a vendor that's not so important, so I can cut it loose, and then so I can accept a little more risk on that front. But if it's a really important vendor, right? If I'm talking about my public cloud provider and there's a big issue there, I got to figure out how I'm going to respond to certain events. And that gets factored into my risk management, right? How am I mitigating the risk? How am I accepting the risk? How am I going to react if something happens? all these things have to be factored in. And for smaller organizations, it's a lot of heavy lifting that they often lack the resources to do. So you can look to partner up and get some assistance, but it's got to be baked into your process and to your overall sort of governance and risk management. If you're not including your vendors, you're really missing a big piece of the puzzle.
Mm-hmm. Yeah, so great points by Charles and Tim. There are different types of vendors that organizations have. Some are business associates, some are just supply chain vendors, right? And like Charles said, it's not a risk assessment issue; it's a risk management issue. The output from a risk assessment will go into a risk management process to now rank rate those risks and based on the criticality of the service. And then decide, what your organizational requirements are to fulfill those risk items. And they may be different because if HIPAA or CFR does not tell you how to address a risk. They tell you you have to address the risk according to your organizational appetite, right? So you have to develop solutions around how you're going to address a risk for remote access or data sharing or supply chain or whatnot. And those are some of the very difficult conversations sometimes to take place because the third party or the BAs typically don't understand what you're asking them to do because they don't have insight into how your risk management process works, right? It's a risk tolerance issue. So there are areas where you can tolerate the risk or transfer the risk, and there are areas where you don't have the luxury to transfer or accept the risk. So you come up with, seem to be draconian requirements, but those have to be done, right? And that's where usually the challenge is, how do you educate your third party to accept your requirements in implementing access or anything.
Mm-hmm. So I'm assuming we have a lot of younger folks in their careers in the audience, because I'm going to go back to the 1980s here, and and we're going to talk a little bit about cloud. So for some of you younger folks, cloud has been around a lot longer than in the year 2020, year 2000. So we used to have these things called mainframes that were multi-tenant with time sharing on it, and they were and people would subscribe to these services, and they were cloud those days. And the only difference between then and now is that we had slow dial-up modems into the cloud of the day those days. So it wasn't as embraced, and the applications weren't as fruitful as they are today because we just had slow access with terminal servers and everything else. So now that we've seen, fast speed to the old time sharing mainframe environments out there, multi-tenant environments now called the cloud, they've brought with them a lot more risk. In fact, at CISO roundtables that I've had, when I would ask, CISOs, their opinion of the cloud and all, and they would tell me, well, now there's no more security by obscurity. If they have an opening, it's not whether or not somebody finds it, because there's always a broadcast of trying to find any mistake that you might have. So you're pretty much all out there. But I'd love to hear from my panelists over here. Let's start with Charles. So how has the cloud environment and the high speed and the easy access to it and the adaptability of it, introduced risk, and how are you mitigating that?
It's a large component of modern risk. And Michael, to be clear, of course, the mainframe part you didn't experience personally, right? You read that in books.
No, that was my year.
I had a box of cards. Trust me, I'm that old.
I
went to school on cards. Yeah.
The public cloud introduces a lot of risk and changes the landscape. And the way that I've explained it to sort of our board and our audit committee and people who are interested in that aspect of it is, so traditional risk management and security audit work and all this kind of work always works around, you know, a defined set of systems that are within the perimeter and scope, right? So there's a scope for the audit, there's a scope for the process, and there's systems that are defined to be in scope, and then you review those systems. Well, when you're dealing with a public cloud environment, it really sort of blows the boundary out of the water of where, you know, how widespread your systems are. And it makes it a lot more difficult to define a boundary, because you say, okay, well, I'm using this system within the public cloud environment, and then it's connected to all these other services. So it's sort of by nature of it spreads and extends the boundary of what you need to review. The accessibility that you mentioned also brings in a number of challenging components, right? So I remember early on doing security work where people were worried about, you know, exfiltration of data into, you know, public forums or, you know, chat platforms, and then banks were looking to restrict that as much as possible. So in the heyday of the data leak protection, right, you were blocking these sites that would allow uploads of data. Now it's literally everywhere. I mean, you can leak data in as many ways as you want, and then you can also process it in as many ways as you want. So your average employee or researcher or person within your environment, maybe just, you know, using a $300 credit from name your favorite cloud provider to spin up some instances and then do some work there. And you just created a whole new level of risk that you were not ready to manage. Because if they decide to use that output for something, you know, you have sort of no visibility into what they're doing in there, how they're doing it, and why. So you need to constantly be sort of reviewing what's going on, educating your workforce, and then making sure they're doing the right things, and having enough of a providing access to your employees so that if they want to do something, you can give them access in a way that's monitored and is controlled, so that they don't end up running wild and doing things completely outside of the paved track. So it's definitely it's added a level of compliance to risk management, a level of complexity to risk management that was not expected, and it adds a lot of work in tracking where your processes are, who's doing what, how they're doing it, and why.
I think one of the things that we have to keep in consideration is, what are we going to use the cloud for? In other words, you can have logs on the cloud, certain type of aggregated data. It gets very, very tough when it's PHI, and we have a lot of Medicare and Medicaid clients. So then that cloud has to be certified at the level would be almost FedRAMP, because it's CMS data. It's not our data. Those are actually their patients coming in to get services from us. So you have to think about, okay, what can I protect in the cloud? Can I meet these, you know, these NIST and high trust requirements in the cloud? And sometimes work with that cloud service provider that can allow you to, you know, have certain types of audit functions. Define that these things are containerized in a certain area, and again for PHI. So it's almost it's a plan to move to the cloud for full data within a healthcare space, at least, because of the security requirements around it.
It's a tough one, right? There's it all has to, you know, cost benefit analysis, and also, like Tim and Charles said, what are you looking to do with the cloud? You know, then you have to decide your journey to the cloud. It's not a flip the switch type of thing. You know, you decide, you know, how you're going to move your compute to the cloud, and then you look at doing, you know, cloud posture assessment, cloud workload posture assessment, and have that process defined, because it's a totally different shift in how now you run your IT operations. And that really has to be taken into account to have the resources trained in managing the cloud-based services.
All right. Well, we want to catch you guys up, but we're close, and we have a few more minutes. We have a couple of questions for you folks from the audience. First question: what would your recommendations be for organizations starting out a cybersecurity program?
I mean, I touched up on that earlier. I think the idea is to start small and build up. If you look at it with the end game in mind right away, it looks like something that's unachievable and unattainable. You have to break it up into pieces. You have to first get the mindset of, you know, audit and compliance and risk management into your engineering workforce, into your legal assistants, and the entire, you know, body of employees who support that environment. So you have to start small, you know, implementing controls, tracking these controls, collecting artifacts, and trying to build up from there. And then you can look into, you know, automated systems and larger platforms that really help implement the full framework, right? So once you have sort of a little bit of momentum going in a direction, looking at a COBIT or a NIST framework will look a lot less intimidating than if you're starting with nothing implemented at all and nothing going on for you. So I think the idea is to start small, spread that mentality around, make sure that people are aware of what you're trying to do, and then really build up on it over a few years.
And quickly, you plan how you're going to structure your cybersecurity group. Are you going to be governance, oversight, or are you actually going to be the people that are looking at all the logs? So you need to spread some of that. Decide how you're going to spread that throughout the organization. Who's going to, from architecture, infrastructure, network, how are they going to take some of that that work? And it's not going to all go from a cybersecurity area, because that can be a heavy lift at first. So spread out the responsibility and define how that's going to happen.
Yeah, excellent points there. And it's again, I'll go back to holistically speaking. If you're looking to start a security or a cybersecurity program, pick up the CISSP book and read through it and look at the 10 domains that it has. It'll give you a very clear understanding of what really needs to take place methodically in an organization to build an information security program, and cybersecurity is a subset of that. If the concepts are not clear, it's virtually impossible to implement anything. If you can't do 2 + 2 = 4, there's going to be a challenge in implementing that, right? So take that, understand it, learn it, and then take that to start building a long-term project of how the cybersecurity program will be implemented. Smaller gains, show those meaningful gains, low-hanging fruit, show progress, educate users, and then learn the business you're in. That is critical to implementing any type of cybersecurity program. Is you have to be immersed in the business, so you speak the business language, understand the business before you can actually look to secure the business.
And I'll just add one more thing. I think a fundamental tenet is least privilege. And for those of you playing cybersecurity bingo out there, waiting for the buzzword zero trust, least privileged evolved into zero trust model. So I think those are key aspects of a cybersecurity program as well.
Mm-hmm.
Okay, we got one last question here for you. Since you deal with a lot of medical and PII, how do you handle sharing data with other entities or groups outside your state or even outside your country?
One of the things we share very little outside the country, but it would be de-identified. In other words, if they're using it for research, usually it's upper level aggregated numbers that they don't need to drill down to the actual patient. But people have to actually understand too what de-identified is. That's just not always taking the name and the first and last name off. There's 18 other identifiers that two together can actually add. So they have to understand what the PHI identifiers are, and then look at the requirements and the risks. We do not share a lot outside of the country. But again, if you look at what the data is used for, and we always read the grant of the researcher. Charles, you probably understand this, but we read these grants specifically because a lot of times they need the aggregated data numbers. Let's say you're looking at COVID concentration in a certain area. They don't need the people's names. So understanding what's the need too, so you don't have to actually, hand out the actual PHI.
Yeah, I'm with Tim on that. We don't share a lot of data outside. The key for us is to know where the PII or the PHI is. So we have to know at all times where we're storing this kind of data to make sure that it doesn't leak out and travel when we don't want it to, because we really don't want to share it at all. But we are in a position where we do share some data for science research. And as Tim mentioned, it's de-identified. You also have to understand the different concepts and the different levels of de-identification, right? So there's a concept that we call a limited data set, where you've basically eliminated the clear identifiers for the person, but the dates are not shifted, so that if you have access to enough information, you can re-identify the data set if needed. In a truly de-identified data set, you should not be able to re-identify anything. And then genomics is a little bit of a gray area right now, because technically, there would be a possibility to re-identify using, someone's DNA. But just a genome sequences of a person is not considered PII. So this data will tend to travel for research.
Excellent points. I think it's a data governance issue, and research data sharing is part of that data governance policy and process. And like Tim and Charles said, that we don't share a whole lot, but when we do have to share for the good for the mankind, we have to figure out a way to share that data in a way that it's not compromising any regulatory requirements.
Yeah, the federal agencies now all require when you apply for a grant that your PI for that grant has a data management plan that they can show how they're going to manage and protect the data and how the data is going to flow. So it's that area is maturing quite fast.
All right, Mike.
All
right.
Good. Next question.
All right. Well, that's our closing question here. Looks like our hour's already up here, but we'll leave you to close it off.
Yeah, sure. So I'd like to mention that these panelists that I have today are actually co-founders of a Security Leaders Roundtable chapters that we've started. We started them in New York City, and then they moved to New Jersey, and now we have actually 12 chapters. There's one actually in Florida. Derek is a member of that as well. That's on here. They're non-sales forums, and we have them before business hours, and we meet every 2 to 3 months. So I welcome you folks to reach out to me. I'll put my Twitter in the chat. I think it went out there, and so you could follow me, and I'll put information about these different chapters. And they're just casual get-togethers before business hours, like we did today. We come up with a topic, and except that it's not just maybe 4 of us, it's whoever wants to chime in, and we have them for about an hour and a half, 2 to 3 month cycles. So feel free to join our club.
All right. And thanks again to everyone that arrived. Thank you to all of our panelists. I definitely appreciate you guys taking your time out to speak to everyone today. And thank you for attendees. And once again, like Mike Melore said, please, if you're interested, please make sure you sign up for the security panel. It is a great talk, and it is not a sales pitch. So yeah, you don't have to worry about vendors constantly spamming you anything. It's a great time to actually contact and chat with other people in the same industry. Thank you all, and see you next time.
B-Sides crew, thank you very much.
Thank you very much.
Thank you.
Thank you.